For centuries, ginger has not only been a popular spice in cuisine, but also a valuable natural remedy in traditional medicine in many countries, especially in China, India, and Southeast Asian nations. Today, as the trend of natural health care continues to grow, ginger is being rediscovered with its many wonderful properties, particularly for people over 50. Ginger, scientifically known as Zingiber officinale, belongs to the Zingiberaceae family and is commonly grown in tropical and subtropical regions. The part primarily used is the rhizome of the plant. Modern scientific research has confirmed many traditional medicinal uses of ginger and discovered additional health benefits, especially for the elderly. As age increases, our bodies face many physiological changes and increased risk of chronic diseases. Ginger, with its bioactive compounds such as gingerol, shogal, paradol, and zingerone, can play an important role in supporting health and preventing some age-related conditions. In this article, we will explore 7 important benefits of ginger for people over 50, based on reliable scientific research, along with effective ways to incorporate ginger into your daily diet.
Benefit 1. Supports joint health and reduces arthritis pain. Powerful anti-inflammatory effects. Arthritis, especially osteoarthritis, is a common health issue in people over 50. Over time, joint cartilage gradually wears away, leading to pain, inflammation, and limited mobility. Studies show that ginger has strong anti-inflammatory effects, similar to some non-steroidal anti-inflammatory drugs, NSAIDs, but with fewer side effects. Gingerol and shogal, 2 main compounds in ginger, can inhibit the production of inflammatory cytokines such as IL-1, IL-6, and TNF-alpha. They also inhibit the activity of cyclooxygenase 2, COX2, a key enzyme involved in inflammation. A study published in the journal Osteoarthritis Cartilage found that ginger extract can significantly reduce inflammatory markers in human cartilage cells, helping to protect joint cartilage from degeneration. In people with knee osteoarthritis, ginger can reduce pain and improve mobility function. In one study, 63% of participants treated with ginger had a significant reduction in knee pain compared to 50% of the placebo group. Versus arthritis, reduces joint stiffness and improves mobility. According to a meta-analysis published in Pain Physician in 2020, ginger use has shown efficacy in reducing pain and improving mobility function in patients with knee osteoarthritis. Study participants reported feeling less pain and being able to move more easily after using ginger. Researchers suggest that ginger could be a useful complementary approach in managing arthritis symptoms, especially for those who cannot tolerate or prefer not to use conventional painkillers. Dosage and usage for joint health. To achieve maximum benefits for joint health, the Arthritis Foundation recommends using supercritical extraction ginger capsules, as this is the most concentrated form and preserves the active ingredients. The recommended dose is 250 milligrams 3 to 4 times daily, not exceeding 4,000 milligrams per day. Additionally, you can add fresh ginger to your daily meals. Drink ginger tea, 1-2 cups daily. Use ginger oil to massage painful joints. Benefit 2. Improves digestive system and reduces nausea. Stimulates digestion and reduces bloating. With age, the digestive system often works less efficiently, leading to problems such as indigestion, bloating, and constipation. Ginger can significantly support the digestive system in people over 50. Studies show that ginger can enhance intestinal motility and gastric emptying rate. Gingerol, a natural component of ginger, improves gastrointestinal motility, the rate at which food exits the stomach and continues through the digestive process. Eating ginger encourages efficient digestion so food doesn't linger as long in the gut. This also helps reduce bloating and gas. Johns Hopkins medicine reduces nausea and vomiting. Ginger has been used for thousands of years to treat nausea, and modern research has confirmed this effectiveness. In particular,
Ginger can be very useful in reducing nausea related to morning sickness during pregnancy, motion sickness, medication, side effects, post-surgical nausea, chemotherapy-induced nausea. A meta-analysis of 10 randomized controlled studies concluded that ginger was more effective than placebo in reducing nausea and vomiting, especially acute chemotherapy-induced nausea. Researcher Matt Crichton and colleagues concluded in their 2019 systematic review that a dose of 1,500 milliliters of ginger daily, divided into multiple doses throughout the day, may be effective in reducing nausea. Nutrients. Supports. Treatment of dyspepsia. Functional dyspepsia. When a person suffers from indigestion with symptoms such as abdominal pain, bloating, feeling too full, belching, and nausea without a clear cause, often accompanies irritable bowel syndrome, IBS. In one study, scientists found that consuming a preparation of ginger and artichoke before a main meal significantly improved indigestion symptoms in people with functional dyspepsia compared to using a placebo. How to use ginger to improve digestion. Ginger tea. Steep a few slices of fresh ginger in hot water for about 5 to 10 minutes, optionally adding a little honey or lemon. Fresh ginger. Before meals. Chew a small slice of ginger before meals to stimulate digestion. Ginger water. Add crushed ginger to filtered water, let it sit all day, and drink in small sips. Ginger capsules. For those who don't like the taste of ginger, capsules are a good alternative. Benefit 3. Powerful antioxidant and anti-inflammatory properties. Reduces oxidative stress related to aging. The aging process is closely linked to oxidative stress, which occurs when there is an imbalance between free radicals and antioxidants in the body. Free radicals are unstable molecules that can damage cells, contributing to aging and the development of many chronic diseases. Ginger contains over 40 antioxidant compounds that protect cells from free radical damage. Gingerol, the main active component in fresh ginger, is a powerful antioxidant that can neutralize free radicals and reduce oxidative stress. In vitro studies show that ginger extract can effectively scavenge superoxide, hydroxyl, and nitric oxide radicals in a dose-dependent manner. Additionally, ginger increases the activity of endogenous antioxidant enzymes such as superoxide dismutase, SOD, catalase, CAT, and glutathione peroxidase, GPX. Fights. Chronic inflammation. A cause of many age-related diseases. Chronic inflammation is a primary cause of many age-related diseases such as heart disease, diabetes, arthritis, and some cancers. Over time, chronic inflammation can damage tissues and cells. Ginger has strong anti-inflammatory properties through inhibition of various inflammatory pathways. Research shows that ginger inhibits the production of prostaglandins and leukotrienes, chemical mediators that cause inflammation in the body. According to 2 recent meta-analyses, ginger supplementation significantly reduced serum levels of C-reactive protein, CRP, TNF-alpha, IL-6, and PGE2, all markers of inflammation in the body. This effect was observed over a period of 2 to 3 months of use. Antioxidant effects on various organs. Animal studies have shown the protective effects of ginger on various organs. Brain. Ginger helps increase SOD and CAT activity in the brain, while reducing the secretion and expression of NF-κB, IL-1B, and malondialdehyde, MDA, a marker of oxidative stress. Liver. Ginger extract reduces MDA levels in the liver and restores the activity of antioxidant enzymes. Kidneys. Ginger and compounds such as 6-gingerol and 6-chagall have kidney protective effects through antioxidant activity and free radical scavenging. Recommended dosage for antioxidant and anti-inflammatory effects. To achieve optimal antioxidant and anti-inflammatory benefits, studies suggest ginger supplements, 1 to 3 g daily for at least 8 to 12 weeks. Ginger tea, 2 to 3 cups daily. Fresh ginger in cuisine, 1–2 teaspoons, 5–10 grams daily. Note that the antioxidant effects of ginger may vary depending on the preparation method. Dried ginger, ginger powder, often has higher antioxidant activity than fresh ginger because the drying process increases the concentration of active compounds. Benefit 4. Protects brain function and prevents cognitive decline. Protects brain cells from oxidative stress. As we age, the brain becomes increasingly vulnerable to oxidative stress and inflammation, which can lead to cognitive decline and increased risk of neurodegenerative diseases such as Alzheimer's and Parkinson's. Ginger contains bioactive compounds such as 6-shogol and 6-gingerol, which may help prevent neurodegenerative diseases by protecting brain cells from oxidative damage. In a study on neural cells, 6-gingerol reduced free radicals and enhanced the activity of antioxidant enzymes, protecting brain cells from the harmful effects of beta-amyloid, a protein associated with Alzheimer's disease. Some animal studies suggest the antioxidants and bioactive compounds in ginger can inhibit inflammatory responses that occur in the brain. This may help prevent age-related cognitive decline. Healthline improves cognitive function in middle-aged and elderly people. A notable study published in the journal Evidence-Based Complementary and Alternative Medicine found that ginger extract improves cognitive function in healthy middle-aged women. Participants who received 400–800 milligrams of ginger extract daily showed improved working memory, information processing speed, and attention. In another study on middle-aged women, the group supplemented with ginger had a significant increase in the amplitude of N100 and P300 waves on electroencephalogram, important indicators of cognitive function and efficient neural activity. Potential in preventing Alzheimer's disease. Alzheimer's disease is characterized by the accumulation of beta-amyloid protein, leading to plaque formation, as well as tangles of tau protein in neurons, oxidative stress, and decreased levels of acetylcholinesterase, ACHE, in certain areas of the brain. Studies on mouse models of Alzheimer's showed that ginger extract reduces synaptic disorder and neuron cell loss. 6-shogol was found to have similar effects by antagonizing the cysteinoleucotriene-1 receptor, an important factor in the pathogenesis of Alzheimer's. Additionally, ginger has the ability to inhibit HE activity, helping maintain levels of acetylcholine, an important neurotransmitter for learning and memory processes in the brain. For Parkinson's disease. Parkinson's disease is a neurodegenerative disorder characterized by the gradual loss of dopamine-producing neurons in certain regions of the brain as age increases. In a mouse model of Parkinson's, ginger extract protected neurons from apoptosis, programmed cell death, increased dopamine levels in important brain regions, and reduced inflammatory agents such as TNF, NO, and ROS, leading to improved Parkinson's symptoms such as motor coordination disorder and bradykinesia. How to supplement. Ginger to improve brain health daily. Ginger supplements, 400–800 milligrams of standardized ginger extract. Ginger tea. Drink 2–3 cups of ginger tea daily, optionally with honey and lemon. Combine ginger with other brain-healthy foods. Add ginger to dishes containing fatty fish, berries, dark green vegetables, and nuts. Fermented ginger, to increase bioavailability. Some studies indicate that fermented ginger may have stronger neuroprotective effects compared to unfermented ginger.
Benefit 5. Supports cardiovascular health, reduces blood pressure, and improves circulation. Hypertension is one of the leading risk factors for cardiovascular disease, and this risk increases with age. Studies show that ginger can help lower blood pressure through several mechanisms. Inhibits voltage-dependent calcium channels, leading to vasodilation. Inhibits angiotensin I converting enzyme, ACE, a key enzyme in blood pressure regulation. Increases nitric oxide, NO levels, a natural vasodilator. Inhibits the activity of angiotensin II. Type 1 receptors. According to a meta-analysis of clinical trials, ginger supplementation at doses 3g daily for 2 months is effective in lowering blood pressure in middle-aged individuals, reduces cholesterol, and prevents atherosclerosis. High cholesterol and blood lipid levels are major risk factors for cardiovascular disease in people over 50. Ginger can help improve blood lipid profiles in several ways. Reduces total cholesterol, reduces low-density lipoprotein, LDL, bad cholesterol, reduces blood triglycerides, increases high-density lipoprotein, HDL, good cholesterol, increases fecal excretion of cholesterol. A study on mice fed a high-fat diet found that combining aerobic exercise and ginger extract led to a significant reduction in serum triglycerides, LDL, and total cholesterol, while significantly increasing HDL levels. Additionally, ginger can prevent the oxidation of ApoAI, a component of HDL, helping maintain the protective function of HDL in hyperlipidemic states. Antiplatelet aggregation prevents thrombosis. Platelet aggregation is an established risk factor for coronary heart disease and stroke. The ability of platelets to aggregate typically increases with age, increasing the risk of blood clot formation. Recently, the potent antiplatelet activity of ginger has been demonstrated in vitro, with efficacy equivalent to or even superior to aspirin in some test models. This suggests that ginger could be a natural method to reduce the risk of blood clot formation in older adults. Dosage and recommendations. To support cardiovascular health, studies suggest ginger supplements, 3g daily for at least 45 days, has been proven effective in reducing serum cholesterol levels in patients with hyperlipidemia. Ginger tea, 2 to 3 cups daily. Fresh ginger in diet, 1 to 2 teaspoons daily. However, caution is advised if you are taking anticoagulant medications, blood pressure medications, or cholesterol-lowering drugs. Consult your doctor before starting high-dose ginger supplementation, especially if you are taking these medications. Benefit 6. Supports blood glucose control and prevents diabetes complications. Improves insulin sensitivity and regulates blood glucose. Age is a major risk factor for type 2 diabetes, a condition associated with insulin resistance and pancreatic beta cell dysfunction. People over 50 have a significantly higher risk of diabetes, and good blood glucose control is crucial to prevent complications. Research shows that ginger can improve hyperglycemia and increase insulin sensitivity through several mechanisms. Increases glucose-stimulated insulin secretion, mediated by glucagon-like peptide 1, GLP-1. Increases the presence of glucose transporter type 4, GLUT4 molecules in skeletal muscle cells, helping glucose enter cells. Facilitates glycogen storage, improving hyperglycemia. In a recent meta-analysis, regular ginger supplementation, 3 grams daily in some studies, reduced fasting blood glucose concentration, insulin resistance, and HbA1c levels in type 2 diabetes patients. Prevents diabetes. Complications. Prolonged hyperglycemia in diabetes causes many dangerous complications, especially in older adults. Ginger may help prevent some of these complications. Prevents advanced glycation. End products, AGEs. In diabetes, prolonged hyperglycemia causes protein glycation associated with the covalent binding of glucose to plasma proteins. This process leads to the formation of advanced glycation end products, AGEs, which accelerate the development of diabetic complications such as nephropathy, retinopathy, neuropathy, and cardiomyopathy. In an in vitro study, 6-gingerol and 6-shogal
were shown to inhibit protein glycation by trapping methylglyoxal, a highly reactive age precursor in diabetes. Prevents vascular calcification. Vascular calcification plays an important role in morbidity and mortality in diabetic patients due to associated cardiovascular complications. Recently, 6-shogaol has been shown to antagonize hyperglycemia-induced vascular calcification by inhibiting the ACT-MAS-ROS signaling pathway and NLRP3, caspase-1, IL-1V, inflammasome in human arterial smooth muscle cells. Reduces diabetic neuropathic pain. Diabetic neuropathy is a common complication, causing significant pain and reduced quality of life in elderly diabetics. In a study, treatment with ginger extract and 6-shogaol alleviated pain associated with diabetic neuropathy through its effects at the spinal cord. Supports weight management. Obesity is an important risk factor for diabetes, hypertension, and many cardiovascular diseases, as well as an important metabolic disease that accelerates the aging process. PPRDD, peroxisome proliferator activated receptor delta, is the main regulator of energy metabolism in skeletal muscle and adipose tissue. Activation of PPRD has been shown to induce fatty acid oxidation and reduce obesity in mice. In one study, ginger extract reduced diet-induced obesity in mice and increased exercise endurance capacity by increasing skeletal muscle fat catabolism. This effect may be mediated by the modulatory actions of 6-shogaol and 6-gingerol on the PPARD signaling pathway. Recent studies also suggest that gut microbiota may represent an important target in the treatment of obesity. In a recent study, ginger supplementation reduced body weight, fatty liver, and insulin resistance by restoring gut microbiota in rats fed a high-fat diet. Dosage and recommendations. To achieve maximum benefits for blood glucose control, studies suggest ginger supplements, 1.63 g daily for at least 8 to 12 weeks. Fresh ginger, 2 to 3 g daily, added to meals or made into tea. Steamed ginger ethanolic extract, SGE, rich in 6-shogaol, can be used at a dose of 100 milliliters daily. Diabetic patients should consult their doctor before starting high-dose ginger supplementation, especially if taking diabetes medications, as ginger may enhance the blood glucose-lowering effects of these medications.
Benefit 7. Boosts immune system and fights infections. Antibacterial and antiviral effects. Reduced immune function and age-related comorbidities increase the risk of developing infections in older people. Recent studies have shown that ginger and its bioactive constituents have antibacterial, antifungal, and antiviral activities. Specifically, ginger and/or its active components have been reported to be active against drug-resistant bacteria such as Escherichia coli, Salmonella typhi, Staphylococcus aureus, Pseudomonas aeruginosa, Mycobacterium tuberculosis, and Enterococcus faecalis, and fungi such as Candida albicans. A recent study found that gingerol, one of the main active compounds in ginger, can inhibit viral replication by binding to the NSP15 viral protein of SARS-CoV-2, the virus that causes COVID-19. This suggests that ginger may have potential in supporting the treatment of some viral diseases. Enhances immune response interferon gamma, IFNJG, a cytokine produced by NK, natural killer cells, and activated by T lymphocytes, plays a critical role in protecting our body against viral and bacterial infections. 6-shogaol has been found to enhance IFN transcription and expression in a dose-dependent manner in human T lymphocyte cells. Additionally, ginger can enhance immune function through the following mechanisms. Increases phagocytic activity of leukocytes, stimulates T lymphocytes and NK cells, regulates anti-inflammatory cytokine production, reduces oxidative stress, which can weaken immune function, supports respiratory system. Ginger has been used in traditional medicine to treat respiratory issues such as cough, sore throat, and colds. Modern studies have begun to confirm some of these uses. Compounds in ginger can thin mucus, helping the body eliminate mucus from the lungs more easily, reduce inflammation in the respiratory tract, inhibit the replication of some respiratory viruses, soothe cough and sore throat. In a recent study, ginger was proposed as an adjunctive treatment for COVID-19 due to its demonstrated beneficial effects in acute respiratory distress syndrome, ARDS, pulmonary fibrosis, pneumonia, and sepsis, conditions that also occur in COVID-19 patients. Dosage and usage. To boost immunity, ginger tea with honey. Combine 1 to 2 slices of fresh ginger with hot water and honey. Drink 2 to 3 cups daily when needed to boost the immune system. Fresh ginger. Chew a small slice of fresh ginger to reduce sore throat and stimulate the immune system. Ginger lemon. Honey water. Combine crushed ginger, lemon juice, and honey in warm water to create a powerful immune-boosting drink. Ginger capsules. 1 to 2 g daily during periods of high infection risk or during flu season.